1875 in Austria, and 2004. As a result of this, we're seeing sea level rise. Now, sea level has been rising for some time. It's been a pretty modest rise, and it has to do with changes in temperature. As water warms, it expands. So, but what we're seeing increasingly is that fresh water from this glacier melt is going into the oceans, and that's what's causing the increasing levels of sea level rise. This is a diagram of the hydrologic cycle. I'm not going to go into this in any great depth, but basically what I want you to take home from this is there's more energy in the system. And that means that water is circulated more quickly. It also means that certain areas get less precipitation. And it means that storms are more intense when they happen. So what does this mean for human health? From our perspective, this is where the rubber hits the road. Environmental changes are significant and of great concern, but in isolation from human health, they're just environmental changes. But a lot of them really will have significant impacts on human health, both domestically and globally. So there are two direct exposures, heat and changes in precipitation. Excuse me, and then there are several changes that have to do with ecosystem changes. So vector-borne and zoonotic disease, biology will change. There'll be a change in the burden of air pollutants, ozone, particulate emissions. And there'll be changes in food supply, food availability, food nutritional content, and all this has to do with complex effects related to elevated carbon dioxide levels at the ground level, as well as temperature, and their impacts on different kinds of plants. And as a result of all of these things, there's clearly likely to be more conflict. So this is becoming a national security issue going forward. It's got a lot of attention from those in our government who are concerned with preserving our security, and it's become quite a motivating factor in some of the current legislation around climate change. Not everywhere is going to be affected in the same way. Cities and low-lying coastal regions, islands, and then areas what we call ecotones, so areas on the edge of an ecosystem are all going to be impacted disproportionately. Of course, drought-prone regions, the desert Southwest, and then areas in the northern part of the world are going to be impacted more. So when I talked about general increases in temperature, that's a global average. In fact, in the northern latitudes, the changes will be much more dramatic. And then as you go further south, the changes in temperature are less. Certainly there are significant changes in weather patterns that are important. So looking forward, what I want you to take away from this is that there's a significant change in the environmental exposure related to heat coming. And what happens is you have both an increase in the mean, so the average temperature over a year is going up. But you also have an increase in the variance for those statisticians out there. Basically, the bell curve gets flatter, so the two tails of it get fatter. If you put those two things together, you have the curve at the bottom right, which is you have much more record hot weather, and then dramatically more extremely hot weather. And this is of concern for several reasons. In cities, we have the urban heat island. I don't know, I looked up to find out what your heat island is here, but on average they are about 3 degrees Celsius over the ambient temperature in rural areas that are adjacent to the city. And what this does, we're still studying this at CDC, looking more and more into it. It seems that urban heat islands actually are amplifying the general warming trend that we're seeing around the country. So if you have 10 extreme heat events in a year out in rural Ohio, in Columbus you may have 15, and it has to do with the urban heat island effect and complicated interactions between heat locally and convection currents and other things. What that means for you all is that extreme heat exposure is more common and probably more severe in urban centers than it is in surrounding areas. Now, in 2003, there was a heat wave in Europe that killed somewhere between 35 and 70,000 people. It's pretty hard to kill 35 to 70,000 people in Europe these days in a week. But it happened. And France bore the brunt of this. They lost about 15,000 people. But it affected people all across the continent. What you can see here is what we call an epidemic curve. And superimposed on that are temperature readings, average and then for 2003. And so you see a steep increase in the ambient temperature about 2 to 3 days before the dramatic rise in mortality. And that's typical for heat waves. Typically, you get this increased exposure, and then it takes a couple days, particularly of high nighttime temperatures where it doesn't cool down, for people to start dying. And heat-related death is entirely preventable, but it's the leading cause of death in the United States related to extreme weather. So we don't have this burden of disease, and probably would not have a heat wave that impacted us in quite the same way. We have more air conditioning. It's more prevalent here in the United States than it is in Europe, which is protected. But we still are vulnerable. Another issue for cities is respiratory disease. So cars and other forms of transit, and then point sources that produce electricity, all produce what we call precursor emissions. They emit nitrous oxide, carbon dioxide, other things into the atmosphere, and then some of these precursor emissions form ozone in the presence of heat and sunlight. And as you can see here, as temperature goes up, more ozone is formed with appropriate precursor emissions. So if you hold precursor emissions constant and temperature goes up, you're going to have more ozone. And ozone is a respiratory irritant. It damages lung tissue. It's not permanent damage, but it's short-term damage, and it does exacerbate diseases like asthma, emphysema, and causes other problems, which lands people in the ED. So on ozone alert days, we see a lot more people in the ER with asthma exacerbations and other things, bronchitis, COPD. Often it's not clear what the diagnosis is, but they clearly are there because they've been outside during the day, which isn't a crime, but unfortunately lands them in the hospital more often than not. So these images here are both Atlanta. One of them is, the top one is a bad pollution day for us in terms of emissions from cars and other sources I talked about. The bottom one, however, is from a day in May of 2008 when we had those fires. You may remember the image I showed you before with several forest fires in southern Georgia and northern Florida. On that particular image, the plume was going south, but on this day, the plume went north up into the city. And so we had significant particulate pollution from these forest fires. It was directly related to the drought. I came into work that day at Emory in the ED and was taking sign out from the doc who'd been on overnight. And we had 5 asthmatics in that ED, which is about a 20-bed ED. That's quite a large number of patients with the same problem. None of them could leave, because if they went outside into this, they'd go straight to the ICU. So we had to keep them there until the air quality improved over the course of the day. So here's an image of, you saw it before, but an image of those forest fires in southern Georgia and northern Florida, and then a map of our extreme drought in the year 2008, which I said thankfully has broken, and now our reservoirs are full, and we're dealing with the opposite end of the spectrum, floods, which I'll talk about in a minute. Vector-borne diseases are another health issue that we need to be concerned about. In the United States, Lyme disease is one of our most prevalent vector-borne diseases, and what we're seeing is that Lyme disease is pretty steadily moving northward and westward as a result of warming. And so the ecosystem is becoming more amenable to ticks and the other flora and fauna that they use in their transmission cycle. And so we need to be concerned about that, and Canada is now paying a lot of attention to that too. But climate is really only one thing that drives vector-borne zoonotic disease dynamics. Probably heard about malaria and concern with climate change. It's gotten a lot of attention. The relationships are quite complicated, and so we at CDC recognize that there's potential for significant expansion of the range of these diseases, dengue and malaria. But a lot of it's impacted by other things like land use change, socioeconomic status, other things. So we don't say climate change is necessarily going to drive catastrophic changes in vector-borne disease, but it's clearly the potential is there. Sea level rise. So we have several problems related to sea level rise. If I were to expand this map here, what you would see is that the lower areas of Florida and Louisiana are all roughly 1 to 3 meters above sea level. There are whole swaths of Florida that, you know, the maximum height is maybe 4 feet above sea level. So if you rise sea level 2 feet by the end of the century, you threaten critical infrastructure in those places. But moreover, when you have a storm, the storm surge is amplified by that much. And so storm surges, which in Katrina were 20 feet, would be 25 feet, or so. It's all